Hey guys, welcome back to the Daily Prime. Dr. Kuntz, and just wanted to chat about what the difference is between rehab-based exercises and working out. Now, if you ask me personally, at least over here at Prime Movement, I don't think much, and here's why. I think there are definitely regressions, modifications, substitutions that need to be made that help bridge the gap to getting you back to working out at the previous level. So just for simplicity, let's say you used to do a leg day, you used to work out, and your squat was around 225 pounds. Let's say you hurt your knee and you had to come and see us because you're in knee pain. Would I be able to get you to do a 225 pound squat that day with knee pain? Of course not. But in my mind, everything we do at that point, if squatting is your number one goal, and we want to get back to do that, everything we do at that point will be on the road for the specificity of squatting. So early on in your program, heck, you might be doing straight leg raises. You might be doing, bridges. You might be doing the knee extension machine. That's gonna be kind of your modern day workout. Not necessarily just rehab exercises. I think there might have to be a hybrid term we can come up with that makes it one and the same. But the rehab exercises in general have been stigmatized, and probably rightfully so, because when I think of rehab exercises, I think of these kind of BS, easy peasy movements that really don't make a whole lot of sense. Usually I have this image of someone just leaving you there to do 3 sets of 10 and you're just like cruising through them, trying to get your numbers just so you can move on the next exercises, and then people will go work out. You know, that's kind of the unfortunate stigma, and I think it's 100% true, where these exercises are not therapeutically aligned to people's goals and to their level of expertise. And I think that's been a huge flaw in the physical therapy world in general. So exercise that we give people are on the route for that person to get back to doing whatever that thing it is. So again, that example I was giving you earlier, let's say they progressed from some easy peasy yet specific workouts like the straight leg raise or a little bit of a bridge, nothing too crazy, but it's hard for them at that point in time. And then maybe it's an air squat. Maybe it's just an air squat. Maybe it's progressed to 5 pounds or whatever it may be. It should be to the point that it's respectful to the healing process. You're not inflaming anything. We're being intelligent about prescribing that, but it should be a workout. It should be, I misspoke a little bit earlier when I said easy peasy. It should be a workout. It should be rather difficult and pain-free, and exactly what they need at that point in time to progress them to get back, in this case, doing a squat at 225. So I think rehab exercises and workouts should be the same. We get a lot of eyes that pop when I tell them this on day one as we go through our first free visit. And I say, you know what? I'm not going to just be giving you rehab exercises just for the sake of doing them. They're most likely going to be very specifically based to your goals and a workout maneuver. Don't get me wrong, we can prescribe like self-tissue releases. Heck, even now and then people can do some foam rolling if they like, and that's part of the workout program. But it's not just necessarily going to be rehab-based exercises that you feel like you're doing just for the sake of getting 3 sets of 10. I think that's really the point I'm trying to get at. These exercises need to have good intent. They need to be, again, therapeutically aligned to what your goals are, and they should be helpful. I find a lot of people, they come here, they've tried working with another physical therapist two or three times, hasn't worked out, and they say, well, I wasn't a good candidate, I never did my exercises. And I'd go, why? Well, I didn't feel like they were helping. Well, hell, I wouldn't do my exercises either if I didn't think they were helping, or if I didn't see that they had the possibility of bridging the gap between where I'm at now in my rehab setting to where I want to go. If I don't see that connection, you've lost my motivation. So I hope that makes sense, guys. Again, long story short, Cliff Note version. Rehab exercises traditionally in the physical therapy world, especially with volumized care, where I'm seeing 2 or 3 people an hour, you really can't prescribe a great exercise and challenge their form and technique, and that's when it becomes kind of that stigmatized, ugly set of exercises that are quite meaningless. What we're trying to really follow through here, and what we're doing really well, is that we are creating an exercise workout program that conforms to your needs and your goals. That's it. Thank you guys so much for tuning in again today for your Daily Prime.